Greetings, this is Doc Weed, and this is Module 4, Diabetes. After completing this content area, you will be able to take Quiz 7. Module 4 covers SLO 2, explain the influence of personal behaviors and responsibilities on developing, treating, and preventing hypokinetic diseases, infectious diseases, stress, and addiction. I am not a doctor of medical knowledge. I am a doctor of kinesiology. So please take what I say as not being expert medical advice. Please seek information from a medical doctor, doctor of osteopathy, or someone else who is certified. In the last presentation, I covered coronary artery disease along with hypokinetic disease and metabolic syndrome. So can you review those and the importance of maintaining good heart health? So today we're going to look at diabetes and look at the 3 types of diabetes. There are 2 common ones. The one is very uncommon. Look at the symptoms, how to diagnose that, and treatments for diabetes, and look at the risk factors specifically for type 2 diabetes, and then how to treat and minimize the effects of diabetes. So it's a chronic or long-term health condition. Chronic meaning that it is not spread by someone sneezing on you after having gone through the COVID pandemic, which was an infectious disease. Tuberculosis is an infectious disease, but the primary killers of Americans are all chronic, long-term, based on a variety of factors, and many of those are behavioral in nature. So the 2 common ones are type 1 and type 2, and we'll look at what the common symptoms are for those. This is an excellent video which we cannot watch on this presentation, but you can watch it on D2L, and it goes over the different types of diabetes that are found and how to best manage that. So some of the signs and symptoms are increased thirst, and just because you're thirsty, those of you are hypochondriacs, it does not mean that you have diabetes. Frequent urination, extreme hunger, unexplained weight loss, the presence of ketones in your urine, unless of course you're on the keto diet, fatigue, irritability, blurred vision, slow healing sores, and also frequent infections of the gums and skin and vaginal area. So which of the 4 components of physical literacy does diabetes information most closely relate to? Is it confidence, motivation, motor competence, or the knowledge and understanding of the benefits of physical activity? I would go with the knowledge and understanding. Here's the definition of physical literacy: about developing the skills, knowledge, and behaviors that give us the confidence and motivation to lead active lives. And broken down, the 4 are confidence, knowledge and understanding the benefits of physical activity, motivation, motor competence, and capacity. So from the day 1 of training to wherever we are when you're watching this video, has your confidence improved? If so, my evil plan is working. Sample size of 1, results may vary. Has your motivation improved? Probably not significantly. But has your motor competence and capacity increased? So are your hurdle walkovers better from day 1 to where you are right now? And hopefully you've heard about the importance of being physically active through the life cycle. So pre-diabetes is part of metabolic syndrome. It causes a disruption in the insulin glucose response, which is insulin resistance. And so if you notice, 96 million adults have pre-diabetes, and more than 8 in 10 of them have no idea. Just like 80% of Americans in the one slide I showed you thought that they are in good health, good or excellent health, and yet all of the facts disprove that. So you'll hear on commercials about A1C, which is your resting blood sugar. So that's critically important for that. So here's some more information about diabetes. Here is a quirky video with ghosts for whatever reason. Again, you can watch that on D2L. We can't watch it in this YouTube presentation. But some of the risk factors for being pre-diabetic or diabetic, being overweight or obese, and we know that we have an overweight and obesity epidemic where anywhere between 69 and 72% of Americans are overweight and obese. We have an incredibly sedentary lifestyle. Having that prediabetes and metabolic syndrome, having that polycystic ovary syndrome, which is part of metabolic syndrome, having an immediate family with diabetes, the size of your baby, specific ethnicities have a higher rate of that, and then uncontrolled diabetes can impact your brain with stroke and other problems. It's a leading known cause of blindness, causes coronary artery disease, which is cardiovascular disease, has problems with your teeth, your nerves, and kidneys, and some other parts of your body. So risk factors for type 1, that is generally known as juvenile onset, even though there are some people who are older and can have that as well. Typically, not all the time, type 1 diabetics are insulin dependent. Type 2 generally happens in adults, even though because of the overweight and obesity epidemic, this sedentary nature of that, there are children under the age of 18 who are developing type 2 diabetes at a shockingly alarming rate. So there's a number of factors here, and type 2 used to be referred to as adult onset, even though that is no longer 100% accurate. So there's no cure for diabetes. There's treatment, but you cannot cure that. Generally speaking, for type 1, those people are going to monitor their insulin levels, and there's different ways of doing that. Back in the old days, they used to have to do a finger stick and then measure their blood, but now they have technology where you'll see people that have these ports on their upper arms, and they can use their smartphone to determine that. And so if their blood sugar is at a certain level, then they have to self-inject with insulin. So A1C is that blood sugar, and you'll hear about that when you hear those different commercials for weight loss and for diabetes. Your glucose tolerance test is another item that they can do. So it's medically determined. Gestational diabetes only happens when some women are pregnant, and that's usually about 2 to 10% of women who are pregnant. So usually once they give birth, then they don't have to worry about that. So how it damages the body. So why you want to avoid getting it, and then if you get it, then how you want to treat that. So heart and blood vessel damage. So increases the risk of myocardial infarctions, heart attacks, and cerebrovascular disease, which are strokes. Nerve damage, where you cannot feel, and then you have this nastiness right here because of that. Also causes blood flow issues. Kidney damage, eye damage. Like I said, one of the leading causes, you'll hear diabetics who have to go get their dialysis treatment because their kidneys are not working. Skin and mouth conditions, osteoporosis, and there's a link between diabetes and Alzheimer's and dementia. These are the 5 standards for a physically literate individual. Here are the references for physical literacy. So what can you take away from the diabetes presentation before you take quiz 7? And you recognize and evaluate the 3 types of diabetes. Describe the symptoms, how it's diagnosed, treatments for diabetes. Review and evaluate the primary risk factors for type 2 diabetes. Critique the various treatments for diabetes and recognize the importance of preventive medicine, and evaluate risk factors. If you have any questions about PHED 1164, feel free to email me or look at the syllabus to find out what time my student hours are, stop by my office, or schedule a WebEx. As always, stay strong.